Welcome to the Mind Gut Conversation, your go-to podcast for exploring cutting-edge ideas in optimal health and the fascinating science of mind-gut microbiome interactions. I'm your host, Emma Maya. Here we bring together thought leaders, groundbreaking researchers, and innovative practitioners to share insights that can transform the way you understand your body, mind, and overall well-being. Whether you're a health enthusiast, a curious learner, or a professional in the field, this podcast is your gateway to unlocking the secrets of the mind-gut connection. So settle in, open your mind, and join us as we journey into the science and stories shaping the future of health. In my latest podcast, I sit down with Stephanie Karzon, a clinical neuropharmacologist and the founder of Beyond Consulting, to discuss the health benefits of psychedelic-assisted therapy and its relevance in women's health. Her company, Beyond Consulting, provides science, research, operations, and strategy solutions to organizations and centers in the natural product, plant medicine, integrative medicine, and psychedelic sectors. Her interests extend beyond neurology, encompassing plant medicines, women's health, and the potential of music to enhance healing. Beyond healthcare, Stephanie is a musician and a writer and has ventured into creating communities centered around music, philanthropy, and the fantastic world of fungi. Welcome to the show, Stephanie. Nice to have you on the show, Stephanie. I should disclose that the way we got to know each other is because we will be on a panel at the upcoming conference, South by Southwest in Austin, on a similar topic as our conversation. So I'm really excited to talk about this. It's not something that I often do in my podcasts, but I think this is something I think a lot of listeners also will be interested in. So let me start out with, you're an individual who has different talents, different interests. How did you get interested in the area of women's health and psychedelics, which will be the topic of our workshop in Austin?
Yeah. Thank you for having me today. So I studied neuropharmacology and I started off in the ICU looking at traumatic brain injury patients, working on different treatment protocols and doing a lot of research. And that was one piece that I remember was interesting because we sometimes talked about the sexual health, hormonal, and fertility changes that would happen following a traumatic brain injury. So that was a very long time ago, but it's almost like I banked that information. And then further down the line, when I did get interested in psychedelic research and medicine, I did want to investigate how those treatments could generally help the TBI population. But I had also had my own journey as a woman experiencing hormonal fluctuations and experiencing the interaction with physicians who often only offered birth control as the option, as the solution. And a lot of people in my community spoke about different plant medicines or herbs as alternatives to balance and regulate hormones. Um, and I ended up seeing a functional physician or functional doctor who gave me a Chinese medicine herb blend that I really scoffed. I scoffed. I was like, this isn't going to do anything for me. But I gave it a chance because I didn't want to once again change birth controls and go down that rabbit hole of doing that. So I tried the Chinese medicine herb blend and it completely changed everything for me. It balanced out all of the different PMS and I would get headaches and I would get bloating and I would have mood fluctuations and I just felt very balanced. I had very good digestion. I was struggling with digestive issues and food sensitivities. And I was just like, okay, so there's definitely something here and I want to investigate it. I'm a scientist, I do research. I want to find out, what is happening here. And also, how can psychedelics, because many psychedelic substances are plants as well, think of psilocybin, like how can we hone in all this information? And honestly, there wasn't a lot at the time. There weren't many people looking at this. So I thought it was an opportunity to self-educate and start finding people who are also interested. And then, having opportunities to do public speaking, advocacy work, lead workshops and whatnot. I was able to now start, finding more people who are interested, transmitting the information. And I think it's important because other women are just like me. They're looking for options and they don't know, what is good information, what is reliable, like, is my physician going to recommend this, right? So it's an interesting field and it's definitely starting to percolate.
Yeah, it's definitely something that's become very, a lot of people are paying attention to this now, and both in science, but also in clinical medicine. And I'm not sure, I'll curious to hear from you about the psychedelic interventions, but certainly women's health and hormonal health is something that very few physicians are specialized in or know more beyond birth control pills um, and estrogen replacement. Uh, um, so yeah, in science, it's also something. I mean, we'll have to see how the current administration will maintain that
Right.
focus. I mean, our group has been funded by the Office of Research Women's Health for some 20 years now, and have been deeply involved in sort of basic and translational research in that area. Um, you've created a an entity, and I'd be curious to hear this. This beyond what you call beyond consulting.
Mhm.
What exactly is that? And
Yeah. So when I decided to, so after I left the ICU working with traumatic brain injury patients, I actually ended up at Johnson and Johnson medical device, surgical device. And I thought I would be there for maybe a couple of years, but that was 6 years. 6 years went right by. And then I decided, I wanted to go back and look at, neurology and look at new innovations for drug therapies. And that's how I found that there were people investigating psychedelics as options. And I began with a research role with a neurologist, which was awesome, and I still have this role, but I wanted to get involved with different initiatives, maybe biotechs. I had a lot of experience helping physicians that were our physician customers at Johnson and Johnson grow their practices and use strategies to find more patients, get more patient referrals, make their surgical schedule more efficient in the hospital. And I thought, I feel like I can combine some of this strategy work from J&J and my clinical work from the hospital and start offering these different services to initiatives and plant medicine brands and companies within this space. So, beyond consulting, right now, our main focus is strategy and operations for clinics and practices and centers that are in the integrative medicine and mental health field. Um, Centers that are focused on psychedelic assisted therapies. And we also offer science and research solutions to plant medicine brands, to these biotechs in the psychedelic and plant medicine fields. So that could span, being commissioned to organize research studies, develop a research program, leading, as a scientific officer on the fractional end. So it's an interesting gamut, from the more entrepreneurial strategy side all the way to the science side. But I felt that since it was only me in the consultancy when I started and I had these two skill sets, I felt like I had two different offerings. So essentially, Beyond Consulting supports a variety of initiatives within psychedelic science and medicine and plant medicine because we're seeing a lot of companies now trying to take these plant medicines and create supplements, or create different therapies because they are not scheduled, right? So we can talk about Kana, as a great example. People are finding that it helps with mood, It's almost this like natural SSRI. And so we're seeing a lot of these brands, come up and people want to see the science. So there's an opportunity there to work with these companies and offer them that, let's create some research, let's put some data out there.
Okay. And has that been successful for you so far?
Yeah.
Yeah.
Yeah. It's been, kind of 2 solid years of ongoing projects. I've worked with 3 different medical directors to launch their clinical practices. I actually stayed on with one clinic called Modern Medicine Services here in Los Angeles as the clinical director. But I still consult with others. And I've done a number of research projects with different plant medicine brands and nonprofits, and it's been great. I love the variety and just meeting, different people with different visions and missions.
How does this consulting in that particular space? I mean, there's obviously a legal landscape that has really limited these efforts with psychedelics in the past. Um, like these clinics that you have consulted with, how are they dodging that legal
Yeah.
these legal limitations?
Yeah, so these clinics that I've worked for are above ground, and so the only psychedelic like medicine or therapy that they're offering at this moment in time is ketamine assisted therapy. Um, MDMA and psilocybin are still not legally available for medical practice, so they're not offering those, but they are in the hopes, of offering these therapies eventually. We got close with MDMA. I think a lot of people got excited, but we still have some work to do. And then psilocybin is, on the heels of MDMA. It seems like a lot of the biotechs that are studying psilocybin are looking at synthetic versions of psilocybin because it seems to have accelerated the process rather than working with the natural compound. But I feel that within, 5 years, we're going to be in a different place, and we very well might see some of these clinics offering more psychedelic assisted therapies to their patients.
So you think there is, I mean, obviously there's different use of these psychedelics. I mean, one is for spiritual growth for people that don't have a disease, and one is for, as a party drug, and the third one is for these medical indications. Um, so you're optimistic that the medical indications, despite these hurdles that this field has run into with um, FDA approval of clinical trials. Um, so you're optimistic that this will be successful ultimately?
Yeah. It's already gone so far. You have companies that are already in phase 3 clinical trials, and MAPS took MDMA all the way. The FDA turned it down, but now they've received more funding to go back and present new studies with new data. Um, on the medical side, it's going to happen. It's just a matter of time. But you said something interesting, like you separated the recreation party and then the spiritual piece for people that, are not, don't have any medical conditions, but are maybe seeking a stronger spiritual connection or self-realization, optimization. And then you have people who might have a variety of mental health conditions, neurological, etc. What I find interesting is working at a practice that offers ketamine as a therapy. It is a psychedelic experience. And I have seen all these patients with treatment-resistant depression or PTSD or just a variety of mental health issues. And even though they're coming to a space that is offering it within this medical therapeutic container, it is still a deeply, deeply spiritual experience. And what's even more interesting is that sometimes we encounter people who don't have a spiritual practice or connection and they develop one. And it's so utterly inspiring to watch, to hear what they have to say and to report just this shift, right, of how they perceive the world and how they perceive themselves in the world. And so what I've realized is even the recreational side of things there is a therapeutic piece. And so the line between what is recreation and what is therapy is not as, I guess, wide. The division is not as wide as we might sometimes think. And of course, using psychedelic substances in recreational environments, if you call it like a party or whatever, right? It is a high risk behavior. But there are many people who are trying to be responsible and are really seeking out these experiences because they are healing to them. And so I always want to acknowledge that, within the container of recreation, there is this like spiritual opportunity or like a therapeutic opportunity.
Yeah, I find that area particularly interesting. So I was recently at a biological psychiatry conference in Phoenix, and there's a lot of discussion about this. Do you need a psychedelic experience for the therapeutic effect, or can you actually do this? There's a lot of emphasis on neuroplasticity
Right.
and rewiring brain circuits without the spiritual experience to it. Um, and it's interesting what you're saying is, but I've also heard people. Um, so when you talk about it, about personal experiences to others, say, oh yeah, I've done mushrooms when I was in college, and without the slightest spiritual dimension, just
Right.
for the fun of it, and it's interesting. So I think the inner attitude has something to do with it as well, and the setting that you're taking it. So this is not just like a medication that works the same way no matter in which setting you take it, but there's something that seems to be contextually dependent.
Yes, I think that is absolutely true. I do think that these medicines without the spiritual experience can still have an effect because, like you mentioned, there is the neuroplasticity piece, and some of these medicines offer, instant relief from symptoms of depression, for example. Like we sometimes see these patients that have a very complex form of depression, very treatment resistant, and one session of ketamine alone, just administration of the medicine, is like a total pattern interrupt for them, and they feel relief from their depressive symptoms instantly, within a couple of hours. So yes, that is also possible, right? And they will feel that relief despite, or in spite of the psychedelic spiritual feeling or experience. Like it is truly on a neuropharmacological level, right? But then if you want to create a long-lasting change, you need to develop a ritual, a practice. You need to use those moments and opportunities of neuroplasticity to go in and do work. Your brain is in this very wide open state. I often make this analogy of childhood where our minds are like open windows, right? And like everything is coming in and everything is coming out, and we're highly susceptible and malleable. Children can learn many languages at once. And as we get older, this window kind of starts to close and it becomes harder for us to learn things as quickly. But not only that, the things that we have learned that have become ingrained can become rigid. And so we get these rigid patterns. And, in spite of everything that we might try to do, we can't undo them, we can't break them. They're very solid. So psychedelics reopen the window. And
Mhm.
now we can go in and we can start to work on them. We can start to reshape. And so in my own opinion, the psychedelic experience is extremely therapeutic. Can you just take psilocybin or like a form of psilocybin that doesn't have the psychedelic experience? And could you just work with the neuroplasticity, without the psychedelic awakening? Maybe, but you're missing out on a lot, right? And I also have a similar experience, that like you shared. But for me, it was when I tried cannabis for the first time. It didn't really come with any intention other than I just want to try it and I want to have a good time with my friends and it's funny and it's silly. But then later on in life, I realized that, oh, you can develop a relationship with this medicinal plant. And if you do practice with intention, it could be a very, beautiful experience. You can learn a lot from those moments. And so, later in life, it actually almost became like a psychedelic experience, and I would have never thought that that would have been possible. So, yeah, the intention and the education, the preparation, the setting, all of it, I think, is a huge part that we shouldn't neglect.
And the thing is, I mean, it's a little bit a distraction from the conversation, but I just thought about it. I mean, there's a big ritual in the traditional medical practice.
Totally.
It's not just taking a medication. You have this whole hospital setting, white coat, authority, like all these things. And
Right.
and many studies show that the effect of medications like antidepressants or pretty much any medication has at least 50% placebo or more in a clinical use. As physicians, we try to deny it. We think it's our specific intervention
Mhm.
and knowledge, but there's a lot of evidence that this ritual that's been created by the medical system is a very powerful part
Yeah.
of the success.
I never really thought of it in that way, but that's so right. The clinical setting, we talk about set and setting with psychedelics and curating a safe space, a beautiful, inspiring space, that doesn't mimic the cold hospital setting. But on the flip side, a patient feels can sometimes feel very cared for walking into a clinical space. It's almost like, oh, I'm here to heal, right? I'm here to get better. There's a person with a white coat, that's my healer. Um, Even priming, like when you administer medicine, priming a patient verbally, like here it comes, or we're going to increase it. Just that verbal priming actually has an effect on how a patient can respond to a medicine. And that's just based on like what they hear, right? It's like already the body is going into this like state of healing and openness and is already preparing to like have a reaction or a response. So yeah, it's very interesting for sure.
So let me jump to another area. So um, combining women's health with psychedelic treatments. So what's when you talk about women's health, is this really dealing with patients post-menopause, um, you know, severe menstrual symptoms, or all of these? And what's the evidence that there is actually? I mean, it's a very complicated system with estrogen receptors
Right.
in the brain, and estrogen is produced not just by the ovaries, but also by the brain and by the gut microbes as well. Um, so it's an area that I think people have always focused on estradiol levels in the circulation, and most people think it's coming all from the ovaries, and most women would think that. Um, but this complicated system is obviously um, amenable to novel treatment approaches that we haven't even dealt with in the past because we understood it in such limited ways.
Right, right. And I think there's been also just like neglect of sex as a biological variable, right? And so historically, even like medical research often favored male participants. And so there has been a lack of understanding about sex-specific treatment responses. And recent findings are suggesting that hormonal influences can lead to women potentially experiencing a heightened emotional state or more introspective journeys, but this could also mean an opportunity on the therapy side, like therapeutic opportunities. So when experiencing challenges with hormone imbalance, which can cause unmanageable symptoms from pain and headaches and severe mood fluctuations, now we're starting to study more than ever, what is the relationship between serotonin and estrogen, right? And it's something that's really important, I think, within like psychiatric conditions, because statistics will demonstrate that women are more susceptible to mood disorders and even eating disorders, and they can be affected by conditions that really only pertain to them, like you mentioned, severe forms of PMS, PMDD, postpartum depression, perimenopausal depression, and I think also interruption of the microbiome and the connection between the brain and the gut is like very much a piece of it here. So there was a study that didn't come out too long ago that explored the sex differences and really dove into the relationship between serotonin and estrogen. And so now, knowing that some of these psychedelics are very serotonergic, is there an opportunity here? And a lot of the new research, the studies that are starting to come out or that are starting, to seek funding, are looking at things like perimenopause, PMDD, even postpartum. And they're even looking at the option of low dose and microdose. Like the University of Auckland is looking at low dose LSD for some of these conditions, because at the end of the day, if you are a woman and you are experiencing this, I don't think you want to be going to an office or a center, right, and tripping.
Yeah.
But if like on the regular, but at the same time, if it was something like, okay, a couple of trips and you're cured of your condition, I think women would do it, but I don't think it's that black and white. So they're exploring low doses that can be done at home safely, that are sub-hallucinogenic. So it decreases the risk. It allows women to potentially just go about their day, right? And maybe there will be a little bit of a felt effect, but not enough to make it impossible for them to go about their day. And I think the important piece in all of this is to look at how estrogen is interacting, right, with the serotonin system. So um, during peak of estrogen in the estrous cycle, there's a higher expression of 5-HT2A, which is a type of serotonin receptor. And there's a lower expression of 5-HT1A. And estrogen will enhance serotonin production, and it will also inhibit its reuptake. It reduces its breakdown and can increase its neural activity. So, in summary, that's what they've found. This makes serotonin more available, and it heightens the receptor sensitivity. So now, as a result, estrogen can modulate the effect of psychedelics, and that means that potentially it could make them more effective by enhancing the brain's plasticity. And there's a lot of anecdotal evidence right now, and there are a lot of universities that are collecting stories. They want to hear from women who have self-medicated with psilocybin or LSD or even San Pedro during these difficult moments to enhance like their mood, if it is PMDD or if it's perimenopausal depression. And I think we're going to find some really, really interesting breakthroughs in the next few years. These are conditions that typically women struggle to find success. I think, women who have PMDD, they're prescribed SSRIs, like that's the common practice, and maybe 60% of women experience relief.
Mhm.
It's not great. It's not great.
Yeah, and then there's side effects, and I mean, there was a recent study. So during pregnancy, a lot of women are on SSRIs during pregnancy, and there was a recent study showing that that could have an effect on increasing the risk of the newborn for severe constipation, which is also a serotonin regulated
Yeah.
function. Um, so. It seems to me, I mean, from looking at the evidence right now and the difficulties of actually doing all these studies that need to be done, but really just at the beginning. I mean, there's a lot of intriguing, suggestive evidence that this is going to be could become a very important piece of the therapy, um, more than with a lot of the other plant-based medicines, which are there's even less evidence, for many of the things that people take. But um, it's an area of potential, and I don't know what's going to happen in the next 5 years with the new regulations that are going to come down, from the government. And um, is this going to be supported, this kind of research? Is this going to move faster, or is it going to be banned again? Because clearly, the reason it was a standstill is because of government um, banning of all these substances as, being addictive and being harmful to people.
Yeah, yeah, you brought up a good point too about the SSRIs and pregnancy and, the SSRIs are deemed safe, so they're deemed safe for pregnancy and currently like if you seek ketamine assisted therapy and you're pregnant or breastfeeding, so there's I guess like a contraindication. They won't give you ketamine necessarily if you're pregnant, but if you're breastfeeding, right? So you've had your child and you're breastfeeding. There was a study by Philip Wolfson that came out last year that determined what like using the half-life, how long it takes for ketamine to be out of the system and safely breastfeed. And so now this opened the door to the exploration that perhaps women who are experiencing postpartum depression could safely use a psychedelic like, medicine like ketamine, which is also relatively safe. I mean, we've been using ketamine for so many years in different applications in the emergency room. It's used on kids, it's used for conscious sedation. It has a very short half-life and it's very fast acting, right? So it makes it effective and it's out of the body. And when it's applied in this psychedelic assisted therapy model, we're talking about doses that are far lower than that anesthetic dose. They're these psycholytic or psychedelic dissociative doses, so it's far more gentle. And an infusion, we're talking about 40 minutes to 60 minutes, an hour later, you're able to go home.
Mhm.
And there was a study that I think it was something like 600, close to 700 women who had C-sections were enrolled in this study. Half were placebo, half were ketamine, and they received ketamine after childbirth. And then the group that received the ketamine had far less postpartum blues and depressive symptoms than the placebo group. And they chose women with C-sections because when you have a C-section versus a natural vaginal birth, you release less of the oxytocin and the serotonin than you usually do. So women who have C-sections are more prone to postpartum blues and depression. So they were looking at that group. And they also showed in a study that the declining levels of estrogen during the luteal phase of our cycles could be a contributing factor to PMDD, but that ketamine could actually activate estrogen receptors and could increase estrogen levels. So now here's another population of women who suffer from the severe form of PMS that could maybe get into a rhythm, or a protocol with, ketamine assisted therapy and interrupt these cycles of depression that come in before they enter their menstrual cycle. And same for postpartum. If you're breastfeeding, perhaps, a dose of ketamine or infrequent use or whatever works for you, whatever, you end up figuring out with your healthcare provider. But there could be this opportunity to now mitigate the symptoms of postpartum depression without medications that are in the body that are now in your breast milk that you're giving to your child. Like if you're breastfeeding, you can essentially wait one day, pump and dump, and then go back to breastfeeding. And you don't have these SSRIs in your system that are going to your child. So it's not just the scheduled psychedelics that have a potential. Even ketamine, which is being used in practice right now, has an opportunity. I wanted to say something. I don't know if this is something that you might find interesting, just given your work. Just speaking back to the opportunity for women and like how they might experience psychedelics in a more heightened way based on their hormones, it also puts them at risk for more adverse events. It's not all glory. And we need to talk about like the pharmacokinetics and dynamic variations. So that means like what a drug does to the body and what the body does to the drug. And drug absorption and metabolism in women, they'll could be different, is often different. A slower drug absorption and metabolism that could lead to higher plasma levels and an increased risk of side effects. So I just wanted to mention that because it's easy to get really, really excited, but we also have to remember that, there are risks.
Yeah, I mean, we didn't really get into this, and probably not the right place to in this discussion. But I mean, there are these intriguing possibilities that part of the psychedelic effect. I mean, there's obviously multiple components, and over time, there's the initial high, and then there's a longer phase where it's not as intense, and then there's after the actual experience. Still has lasting effects, at least that you notice for a couple of days.
Yeah.
And in my opinion, it's quite possible that some of these, one or two of these components are influenced by the interactions with the microbes. Clearly, they also have serotonin receptors. Um, some of them can produce serotonin. But it's quite possible. I mean, I would think that the initial phase of a psychedelic experience is is probably related to the immediate absorption from the small intestine. But I think these later phases, and particularly the neuroplastic effect, could easily be from products that the microbes generate in response to stimulation of their 5-HT2A receptor. It's a hypothesis, but it's
Yeah, that's interesting.
um, yeah, I mean, there will be a lot of, that's once the legal situation is sort of clears the air completely, will be a lot of people, that because it's such a fascinating area and a new area and definitely in psychiatry. I noticed at this prominent psychiatry meeting, there were a couple of sessions, but they were very very conservative. They were not, that's not really, that's all psychiatrists are now embracing, psychedelics. There's still skepticism. And so, um,
Yeah. And even in practice from my experience being at a clinic and seeing patients and watching them progress, it's not one size fits all. And it's not because you had success doing it in one way with one patient that it will happen in the same way with another patient. There's so much variability, which doesn't mean that it's not effective or that it needs like it begs skepticism. It's more that it's incredibly high touch work that you can't protocolize and that you can't just assume will be replicable. It's just not. It's like we know the dose ranges that are safe. We realize patterns with doses, but then the work and the personalized, tailored work for every individual, that's what's really important. And it takes a lot of time. There's so much time spent with patients to ensure that we are understanding them, that we are keeping them safe. And some patients, they come in for only a few sessions and then they're just feeling really, really, really good. And, you can't necessarily force them to come back. You can't force them to stay in therapy. You recommend continue with your therapy. But we had this discussion as a team like yesterday. What happens when a patient does a ketamine therapy experience, has their integration session with their therapist, and then says, I'm okay, I'm good. Where does the responsibility end here? Now they're 2 weeks out, they're feeling good, but there are stories and there are stories and reports of after the 2 weeks, there's a decline. And if the patient is not in our care, what do we do? So I think that piece is something that clinicians, providers, facilitators, therapists, what have you, they need to really be thinking about. It's like, how do we keep people safe? Not just like, how do we ensure their progress, but everyone is so different. So where does the responsibility kind of begin and end? And everyone is so different. You
so
really
I mean,
need to stay in touch with those patients
this
somehow.
also brings up a potential major limitation. Which is, what is what is a business model for this? So because you need this, it's not just giving an infusion or taking the product one time, it's like this integration, which some people think is actually it's probably not necessary for the spiritual experience and the spiritual growth, even though it helps as well. But it's definitely necessary for people with mental disorders, with depression, anxiety. You can just say,
Mhm.
now now we
No,
did.
you're good.
Yeah, yeah, now you're good. And first of all, are there enough trained, really professionally trained individuals, or are a lot of, therapists jumping on the bandwagon and say, "Oh, I'm going to take a course, a few months course, and then I'm a specialist in that." And secondly, if you need this prolonged intervention by a therapist, how is this paid for? By insurance companies, or does this only select private patients who can afford doing that? And
Yeah, this is such a good question because it's a question that I get asked all the time. And having worked with, a few clinics and consulted with many clinicians who want to open a practice, this question of like, how do I practice ethically and give my patients the best care, but how do I make this a financially viable model? And what I've come to observe is that you have, I guess, maybe three different kinds of models. You have one model that is a ketamine clinic where people are coming in for infusions every couple of hours and then they're being released. So you can have, you know, multiple patients going at the same time. You can have a lean staff, right? You can have a physician or a nurse practitioner. You can have maybe like a couple of nurses overseeing. And then that patient is not tied to having to do additional therapy or having someone really sit one-on-one. So it's almost like this churning, right? So you have many patients coming in, many patients coming out, and you can see a lot of people in the same day. And there's no, I guess, like requirement for the psychotherapy. And there isn't even psychotherapy happening during the session. Like the patients are having these doses and they have their masks and they're mostly in silent. So you have that model. That model will make money because the cost of operation is low and the cost, of the patient can be high, but it could also be more affordable because your overhead isn't so high. So you can bring the cost of the patient lower. The other model is the Spravato model by Johnson and Johnson, which has now been approved as a standalone therapy. Previously, you had to also prescribe an SSRI. So now there's more access, but it also means that you can see more patients, you can make more money. The Spravato is a lighter experience than an intramuscular or an intravenous infusion. So again, you're able to see more patients. Patients have reimbursement they can use their insurance, so they don't have to go out of pocket. So clinics that offer Spravato are going to have a business model that is viable. You're also seeing a lot of clinics that are doing TMS and Spravato as well, and TMS also generates a lot of money. So those are two models that are going to be viable. Now, for the clinicians and the practitioners who want real ketamine assisted therapy, meaning time spent with the patient during, time spent with the patient after, you can't necessarily have, 7 patients going at once and a clinic full of highly certified staff, right? Because now you're paying physicians and like highly skilled therapists, your overhead is just going to be so high. So how is that going to work? But that is the real work. That is what we want. So my solution, this is the advice that I give, is build an integrative model, which is what we did with modern medicine here in LA, is we have integrative medicine physicians as well, and we have other services. So the mental health piece and the ketamine assisted therapy piece become a service and a modality of care that we provide within an integrative model. And so now you're not just relying on people going out of pocket for ketamine assisted therapy, and trying to manage your very high overhead. So having maybe services or consultations that require a certain, skill or subset of skills and that people are willing to pay for. But having some sort of insurance reimbursement is also going to be helpful. So it's this internal dance. It's one of the biggest conversations amongst operators and owners of these clinics is how do I care for my patients in the best way possible? Hire the best people, right? But also not just break even, like thrive as a business. Yeah, it's not obvious. It's not obvious. And that's why not everyone's doing it. And that's also why you also have clinics that open and get very enthusiastic and then close down because it wasn't well thought out.
Yeah, it's almost to me, it seems, um, that for therapy resistant patients, the cost would be justifiable. But if somebody responds, to an SSRI satisfactorily,
Yeah.
there's from an insurance company standpoint, there's probably no use to spend 5 times as much on their patient. But I think there's a lot of patients that do not respond to SSRIs or there's contraindications or side effects. So that would seem to me being one of the major.
Yeah, and then we're also seeing people, and not just with treatment-resistant depression, but other conditions that are responding to ketamine-assisted therapy. Right now, there's a lot of talk about eating disorders and OCD because of the nature of these these pathologies or these conditions. There's a lot of rigidity, right? And so the ketamine, that experience seems to allow for more malleability and flexibility. And it's the rewiring of the patterns. Whereas, you know, our classic medications might not be able to offer enough neuroplasticity, or just the felt effect, right? Ketamine is a dissociative, and you don't need to dissociate so much that you're sent off into outer space. But there's something to be said about that out of body experience and what it does on the emotional level, how it actually helps quiet or lessen the emotional burden and gives people the courage to actually face the deeper rooted issues. So there's a lot of success with patients who do suffer from OCD and eating disorders, and we're starting to just see more applications like the women's health applications, and also within neurology, post-acute traumatic brain injury. You have these functional symptoms. You have symptoms that affect your mood, but you also have things like insomnia, and patients are finding success because the narrative and the story that we're always hearing with TBI patients is it my head injury that's making me depressed, or is it the fact that my quality of life is different that's making me depressed? Like, is there something physical that happened? Like it's like this chicken before the egg situation, but at the end of the day, it becomes a mental health challenge. Um, way past the moment that the brain was injured, and after it's healed, there's all of these lingering functional symptoms. And even more interestingly, there's been recent publications about functional seizures, which are a psychosomatic type seizure. These are functional neurological disorders, and they present like epilepsy, but they're not epilepsy. And it's a psychological condition. And a neurologist that I work very closely with, who's also my mentor, Dr. Evan Lewis, who's in Toronto, has published on this topic, and he has found success with his functional seizure patients and ketamine assisted therapy. So now we're seeing applications beyond major depressive disorder and TRD. So it's gonna evolve, and eventually, I mean, I think that we're going to start seeing insurance and reimbursement for intramuscular and IV, but it's gonna take some time. And for some people, it's worth it, like you said, for them to go out of pocket, and for others, they just can't. And so options like Spravato, where you can use your insurance, I think are fantastic options. But I always encourage people not to just do the nasal ketamine and not be in therapy. You should still have the psychotherapy. That's really where the deep work and the lasting change will happen.
Yeah, it's interesting that you mentioned this word, these functional seizures. So, the word functional has been used a lot in gastroenterology as well, these functional GI
Yeah.
disorders. like IBS or functional dyspepsia or cyclical vomiting syndrome. Um, and so that's an area, that I wouldn't be surprised if a reset at the brain level, and most of these disorders have a brain component. In my opinion, it's still controversial. It's a brain gut disorder, but in my opinion, the brain component is the driving part. Um, and there's obviously a huge opportunity because none of the medications that are available are really treating the whole syndrome. There are medications that work for the constipation or for the
Right.
diarrhea um, but for the whole syndrome, there's still nothing despite major efforts by the pharmaceutical industry in the 80s and 90s. So that's another area and what you said about the functional seizures. I mean, it's kind of interesting that this may be another group
Mm.
of indications.
Do you
So
think do you think it's a hypothalamic, like, do you think we're talking about like a hypothalamic reset almost? That's how I sometimes think or wonder about it.
yeah, it's yeah, what the main reset, obviously you have all these networks, as you know, all these networks in the brain. It's not a particular region that is responsible for particular things, but um, the central autonomic network, which has the hypothalamus in it as a key region. Um, if you alter one of those regions, it will change the whole network, and it's quite possible. I mean, you could almost sometimes think about it. It's like electroshock therapy, which resets the system. And so this would be a biochemical reset,
Yeah.
with psychedelics. Um, Another indication I want to get your opinion on because it's part of your interest and expertise. So so when you talk about sexual health, what exactly is that? The hormonal health, or is this um, sexual functioning, or I mean, what do you mean? And is there an indication for psychedelics as well?
Yeah, I guess sexual health for me does include the hormonal health, and it also will include our, I guess, like our sexual relationship and our sexual relationship, intimacy relationships with self and with partners. It's not just our hormones and our bodies on a cellular level per se. It's also just what is our relationship to sex? Do we have, traumas around sex? What is our relationship with our partner? What is our intimacy practice, and what is our connection to self, to our bodies, and to our sexual relationship? So it's a wide range. And I do think that different plant medicines, legal kinds that have like psychoactive components or even psychedelics, when we talk about spirituality and connection, if you build a ritual around the use and the practice, you can also kind of weave this into your sexual relationship with your partner, but also just that relationship with self, in order to have a healthy sexual relationship in your relation, in your like romantic relationship or in your partnership, you need to have a healthy connection to self. If you have past, traumas or blocks, those need to be healed. And so there are opportunities. We talk about MDMA for PTSD, for sexual trauma and PTSD, but there's also talks of MDMA for couples therapy. And there's also talks of other psychoactive substances that could help, bond people to themselves and help people connect to each other. And just an example of that is canna. Scaletium, this South African plant, has such a rich history, used, by both men, women, and children for different things. But there is a history of creating a ritual for intimacy. And when we talk about activation of serotonin and dopamine, it does foster feelings of trust, empathy, connectedness. And so, of course, when you weave in the practice of psychedelics, especially in a very like intentional ritual, you can use them as tools to better your connection. And then obviously, if you're suffering from hormonal imbalances that are affecting your sexual health, um, your drive, or just leading to, very symptomatic states, whether it's like migraines, fatigue, pain, and mood disorders. If you do find success with any of these plant medicines, obviously it's going to spill into your relationship and how enjoyable your sexual relationship and health will be. And there's also really interest. It's not very investigated yet, but I'm really interested in the hypothalamic pituitary gonadal axis, HPG axis, and for people who are dysregulated on that level, can psychedelic medicines be a solution? I spoke about this at the beginning, but my experience was that a lot of women and men, but a lot of women post TBI experienced infertility or hormonal imbalance. So, what is it? Is it the injury itself? Is it brain inflammation? Does something happen at the level of the pituitary gland? Like, what is it? We don't really know. And what is the possible role of psychedelic medicine as a therapy here? So all interesting paths to be explored in the future, I guess.
Yeah, this is a wide range of applications, all areas that we don't really have satisfactory treatments for. I mean, this is
Right.
the issue.
It's an option. You said it before, SSRIs could be the perfect solution for someone, and then for others it might not be. So we just need options, not necessarily replacements.
Yeah, yeah. Looking in the crystal ball, where would
Mm.
you think that this field will be in 10 years from now? Will psychedelics be a routine part of medical and psychiatric practice, or will we still be dealing with the same obstacles and limitations as has been the case for the last decades?
I'm optimistic, but I'm also a realist, and I think in 10 years, I think we'll have access to more therapies on a legal level, but I don't think we'll be at a point where things are routine, right? But I do think things will be more widely accepted within the medical field because 10 years, it's a long time. I think it gives us a long runway to publish research and to engage in different aspects of drug development. And I think we're also going to learn a lot. And that's the key piece for me is we need to learn because we haven't studied long-term effects, right? And even simple practices like microdosing or using low dose psychedelics, we feel like the risk is reduced because we're using low doses, but we still don't know what happens in the body when you microdose for days and months at a time over the period of years and years. So I think we're going to be definitely better informed. But I'm hoping for a landscape that has now offered more acceptance. And I'm particularly excited for women's health. I'm also excited for applications within neurology. Like I think about rehabilitation from stroke, and spinal cord injury, which is an area that I do study. And I think that there is something to be said about how this neuroplasticity could be used for rehabilitation. So I think more applications are on the horizon.
Yeah, I think we should, end at this careful but overall optimistic note. It was great talking to you, and I'm looking forward to continue this conversation at
Oh,
our workshop in Austin in a
yeah,
month.
it'll be a good time.
So, thanks.
Thank you for having me.
Okay, bye bye.
Bye, thanks.